my people are the Okanagan people from British Columbia, Canada. We are peoples who have lived in our areas for 8,000 years or so.
Westbank First Nations in Canada is probably the most progressive success story there is. They are a self-governing nation. They have done a phenomenal job in showing what's possible in the rest of the Canadian First Nations community.
We are working with Aspen Medical and Ad Vitam Healthcare, and our intention is to build a facility, first of its kind in Canada. That facility will be focused in on Aboriginal health.
And there's a really good correlation between what we want to do with other communities in Canada and what is happening in Australia for the First Nations and the Aboriginal communities' independence and taking that pride and that strength back in their communities.
It's a great opportunity for us, being at the World Indigenous Business Forum, being this close to Alice Springs, for example. I give my deepest respect and most recognized respect. And I appreciate the culture and I appreciate your dance. And I say, Linda, thank you very much for having us here. We're honored to be here and we look forward to learning more about your people. Well, it's a learning exercise. It's understanding what types of services work, what is really needed to accommodate the needs of the Indigenous peoples of these lands, and it's understanding that.
RAHC is an organisation that began in October 2008 and was funded by the Australian Government to attract and recruit urban-based health professionals to work in remote Aboriginal communities, and our numbers have grown quite sharply over the years. We look to recruit nurses, general practitioners, oral health and allied health professionals.
When we're looking at physicians, for example, and nurses, what drives those individuals? Why do they provide the service that they're doing? What works? What is needed as far as the healthcare service on these lands for the people? How can things be made better? And I think that understanding will help us when I go back home to my lands, to my community, and when we develop the private healthcare facility that we're embarking upon now.
Chief Louie is on a fact-finding mission to he's interested in the work that Aspen Medical does in a variety of areas around Australia, and in particular he sees the remote area health corps as being a model that is applicable, and he wants to see how it operates on the ground, and we've brought him out here to get testimonials from the clinic and the health professionals that work with RAHC.
And I'm very, very fortunate and I'm very pleased to be involved in the healthcare field, and we'll get more involved as time and years go by.